Coming up today, checking a child's eyes. Every kid needs an eye exam, especially before they start school. But what are doctors looking for, and what options do parents have if something is off? Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. What you don't see in your children can impact what they see for the rest of their lives. Janine Kiesling introduces us to a mom who is so glad doctors looked into her son's eyes.
Jenny Prochnow had no idea her little boy was having trouble with his vision, but a routine visit to the doctor was an eye-opener for the whole family. Hank had a significant problem. It was something common and simple to fix, but it had gone undetected. It could have caused bigger complications later in life, even blindness.
It's a watering can.
4-year-old Hank Prochnow loves to have a good time.
A, and then where's your N?
My N right here.
From spelling with his magnetic letters
Hank. It's a tiny Spidey.
to playing with his action figures.
Green Goblin.
To look at Hank, you would never know anything was ever wrong. When his mom, Jenny, took Hank to his 3-year-old wellness check, she was stunned when his pediatrician diagnosed Hank with amblyopia, more commonly known as a lazy eye. She'd never noticed anything different about his left eye until that moment.
I didn't think it was significant enough or anything, but when we went there, they had this little iPad that they used. They shut the lights off, and that's when it showed up.
Doctors say 2 to 5% of children are affected by amblyopia. It is the most common cause of vision loss and impairment in children. Hank's pediatrician immediately referred the family to the pediatric eye care specialist at the University of Kansas Health System.
We took it serious and did the patching and got him glasses, and he wears his glasses really, really well, which is a big help.
With each checkup, Hank's eyes are improving, and the hope is by the time Hank is 9, he will no longer need glasses. Jenny is grateful Hank was diagnosed early, even more grateful to the team that treated her little boy here at the health system.
The experience has been wonderful. The nurses are all great. They're very patient with Hank.
As for Hank, it's full steam ahead, and he's not looking back.
And this morning, we are learning a whole lot more about pediatric eye care with our guest this morning. Right here next to me is Dr. Emily Broxterman. She is a pediatric ophthalmologist at the Comprehensive Eye Center here at the University of Kansas Health System. And she works alongside Tori Roush across the table, who is a certified orthoptist. And I had not heard of that. You're going to tell us about that job title here in just a moment. So thank you both for joining us. And Hank's sure a cutie. How fun is he to work with?
He is so much fun. He's a power punch.
He's a power punch, a good handful. We love it. And we want to talk more specifically about Hank's case and also just pediatric eye care in general. I'm sure folks and parents out there have lots of questions. We said that children should get their eyes checked. So Dr. Broxterman, tell us, should parents be seeking out a specialist for childhood eye exams, or is it something a pediatrician can do? Because I know when I take my kids to the pediatrician annually, they look at the eye chart. But when do we need to do more?
Yeah, absolutely. The pediatricians are wonderful resources for parents. They're really out there on the front line, seeing those kids day in and out their regular checkup exams. And so they do a lot of the basic screenings to flag kids who have vision problems and send them our way for kind of secondary higher level exams. And so we have a wonderful relationship with the pediatricians in the community, both here at KU and outside of the university as well. What I would recommend to parents is if they have a child who's showing signs or symptoms that may represent a vision problem, or if they have a strong family history of eye disorders like a lazy eye at an early age, those are kids that probably would need to come in and get a better exam beyond just what the pediatrician offers.
And when you say if parents have any concerns, what might they see at home that would signal an issue?
Yeah, so it's really in the younger kids, the kids that are too young to be able to say, Mom, my eye hurts, or Mom, I can't see, right? A lot of times it's eye rubbing, it's squinting, it's falling down the stairs, or having a little problem with depth perception, things that parents look at and say, okay, that's not quite on track for their age. could it be related to vision or could it be related to their eyes?
And you touched on it. Adults, of course, could use their words to describe how they're feeling and what's going on with their eyes, but we know young kids cannot. So, Tori, how much of a challenge is that when you're trying to diagnose a child, asking them questions and not knowing if you're getting the right answers?
Right, so it can be, but the big thing is that we have a skill set that we went to training for. Well, I trained at an orthoptic program, but spent those 2 years learning skills and different techniques for getting exams in those pre-verbal or non-verbal kids that help us get an accurate assessment and do the best that we can for those kids in getting a good eye exam.
Dr. Bruxman, same question. Any challenges, and how do you get through those?
It can be challenging at times, but it's also what makes our job fun. You know, you get to relate with those kids and, really just meeting them on their level. Some kids come in, they're timid, they're scared, sometimes a little tearful and not really sure what's going to happen. And so providing the comfort and the patience for those kids. Others come in like Hank, ready to go, full of energy, and being able to match them on their level and really kind of help them through that exam, just really based on the patient.
Well, and we talked a little bit about it this morning, where you don't wear a white coat because you said, I have to be down on the floor a lot. I got to move around. I got to get down on their level and kind of get on all fours and get down there and see what's going on. Tori, for some people who may not be familiar with your job title, I was working on how to pronounce it today. Yeah. Pronounce it and tell us what it is.
So it's an orthoptist. It's okay, no one knows what it is. But essentially the easiest way to tell you what that is kind of like a PA to a pediatric ophthalmologist. So I specialize in strabismus, kids and eyes, amblyopia, helping the clinical part of that and diagnosing and assessments of vision and all of those things.
So orthoptist, ophthalmologist,
yes.
And then you have a third part of your team, which makes this team very, very specialized.
Yeah, our team is very unique in that we're small. There's 3 of us, but we really cover the gamut. As Tori was saying, her role is she has gone to specialty training for vision, alignment, motility. We have a lot of kids with visual impairments, a lot of kids with developmental delays and things that it's really hard and takes a lot of time and patience to get the information we need from those children. And so she's able to spend the time and really work with those parents to get the information that we need. Dr. Weiser is our pediatric optometrist, and she is wonderful with the children. She covers a lot of routine annual eye exams, contact lenses, kind of that routine annual care and basic medical conditions. And then I cover more the complex medical conditions and the surgical specialties. So kids who have drifting eyes or things that need more complex care or surgical care come to me. So with the 3 of us, we really cover the gamut from the most routine things all the way up to surgical and complex conditions.
So let's get back to our patient Hank, and I want to talk about his mom. I'm a mom. I know a lot of people watching are, and you're always trying to look for those subtle signs if there's anything wrong with your kid when it comes to any issue. But Hank's mom didn't notice it, but the doctor did. Tell us about the difference between what you wouldn't notice at home, but what a doctor would see when you come to even your pediatrician.
Yeah, so a lot of people talk about lazy eye. Lazy eye is a common thing that people know in the community, and it can really refer to anything that's wrong with one eye, right? Poor vision, you can't see out of one eye. Maybe the eye's not straight and it's drifting to the side. And based on what that is, it has varying levels of symptoms, right? If your child's eye is drifting, most parents are going to see that and bring their kid in. But in Hank's situation, where it's purely vision, there are no external signs or symptoms for that parent to detect it. And so that's why it's really, really important for those kids to have those eye screenings and those vision screenings with a pediatrician, and then come and see us so that we can not only identify it, but treat it early before it becomes something more permanent and irreparable.
So let's talk about how it was diagnosed. We heard Hank's mom describe a doctor getting an iPad and then shutting off the lights. What was the doctor talking about or trying to look for?
So most pediatricians will do some sort of electronic screening, usually starting around the age of 1 or so. Sometimes it's on a camera, sometimes it's on a phone, an app on a phone. But the goal of that screening device is it can pick up on misalignment. So if looking at pupils, if the pupils aren't straight, if there's some sort of opacity in the pupil, and then also is pretty good at detecting kids who have really high prescriptions or need for glasses. And so it is a great, again, screening tool to flag kids who may need more intensive examination and treatment, and then sending them our way.
So what was Hank ultimately diagnosed with, and how did you treat it? And what are the different types of treatments that people get with your team?
Yeah, so Hank had something called amblyopia, which is poor vision in one eye. In his case, it was because he had a very high prescription in one eye and not the other. And what happens in little children is we're not necessarily looking at eyes, we're looking at their brain. In those first years, there's so much visual development and brain development going on that his brain just ignores that blurry vision and ignores that right eye. And what happens over time is his vision lags behind. Even when you put glasses on, that vision falls behind, which requires patching and more intensive treatment. Not for the eyes, the glasses do a great job for the eyes, but you're really working on that brain and making sure you're promoting that good visual development in the brain.
So Tori, are these like temporary glasses? What I heard in that story was that eventually he wouldn't need the glasses. So that's really nice to know that this is truly fixable if caught early enough.
Right. So it depends. Every kid's a little bit different.
Okay.
You can't predict what their prescriptions will change to as they grow. But the patching and the glasses are full-time as that brain-eye connection fully develops. There's not a hard and fast rule, but around 7 to 9 is when that brain-eye connection fully develops. So it's important to catch all these things and do patching and glasses and all the treatments that you can before, so that they have the best vision potential that they can get.
I want to bring COVID into this because when I sent my kids back to school and the masks covered the teachers' faces, it really concerned me as a parent because we think of vision, how that's impacting a childhood's learning and development. Let's talk a little bit about that. You can't read lips, you can't see the way things are being sounded out. How can vision, other than just what they see, really impact their long-term learning?
Yeah, vision is really a process, a developing process throughout childhood. Think of a baby when they're born. That first few months, there's so much of their milestones, their social development is really visual, right? Learning to recognize faces, bonding with their parents, the social smile, all that is relative to their developing vision. And then as they get to walking and moving around, learning that depth perception, spatial awareness around them. And so those early months are really critical for that visual development to occur. And then once a child gets into elementary school, then you take it to that next level, right? You need to read, writing, academic success in the world as you get out into your occupation. We have a lot of kids that come in to see us that are really struggling in school. They've got IEPs, they've been working with tutors and really not having success. And they come to see us and it's really just that they don't have good vision. And we fix that and it really opens the door for them to have success academically and again into their future self-esteem. It really covers a lot of territory.
So when do kids get their eye exams? Are newborn babies getting them? Are we just getting them as they head into school? I know we're getting those annual checks, but when might they need to go beyond a pediatric visit?
Right, so as Dr. Brockstrom had said earlier, if there's a strong family history, if the parents are notice anything, concerns, she sees and we see all ages from newborns up until your oldest is 20, and then everywhere in between. So if there's a family history or like concerns of any sort, definitely recommend getting an eye exam. It's better earlier than later,
Always.
just based on catching those things early on to treat them.
Preventative medicine. When is a child's vision fully developed?
Again, it's kind of a spectrum. Usually by 6 months, most children have developed appropriate vision to be able to see their parents. Color vision develops by that point. They're learning to use their eyes and focus them together. But then again, like I mentioned before, there's a lot more visual development that happens all the way through that first year in learning depth perception and learning spatial awareness around you as you get up and start mobility and moving around the world. And so I would say the first 6 months is where the most of that vision develops. But again, it's a process that continues throughout childhood.
We talk about things we take for granted, and just as we see and walk around in the world and hear things, and you don't realize just how important it is not to take something so important for granted. If you want to read more about the work that these two do and their team, we're going to put a QR code here on your screen. You can scan it or go to kansashealthsystem.com/pediatric eye. So what are the most common problems that you see from pediatric patients? And I want to hear from both of you.
Well, for me, like I said, I specialize in strabismus and amblyopia and vision assessments of any age. So that's what I primarily specialize in and see is strabismus. So crossing, drifting, and then amblyopia, we do patching and treatments and stuff for that.
And how common is amblyopia?
Amblyopia.
You know, I told you I don't say big
That's
words
okay.
here.
No one knows how. Amblyopia, how common is it?
I think about 5% of the population, the pediatric population.
Common to us, but
Common to you, of course.
population-wise,
That's why you're here. How often do pediatric patients need surgery to correct their vision?
So the surgery is more for misalignment. So kids' eyes, if you think you hear of kids' eyes who cross in, who drift out, that aren't straight, that's really what the primary surgical goal for us is, to correct those eyes pointing straight ahead so those children can learn the ability to use those eyes together, that binocular vision and cooperation between both eyes. And so surgery is more designated towards the misalignment of the eyes, not so much for the vision itself. The vision or the amblyopia is where, as Tori was mentioning, the patching comes into play.
What else is common when it comes to eye issues and eye care?
People don't necessarily realize that the same conditions that affect adults also affect children. You know, we see pediatric glaucoma, pediatric retinal disorders and detachments, pediatric corneal issues, pediatric cataracts. You know, all of those same issues that affect adults also affect young children and babies. The difference is it's not just that disease, but it's looking at their visual development and saying, okay, yes, we can take out the cataract, but then how do we work with that baby to make sure they develop that good vision?
Okay, how do you get a young child in your pediatric clinic to cooperate during exam? You really need to hone in and see and recognize what's going on. So how do you do it?
Right. So
I think we have some video of how you do it.
honestly, I mean, as Dr. Brocksterman kind of explained, you have to kind of adapt to their energy and make them feel as comfortable as you can.
You're pulling out the stops
Yeah,
here.
we obviously
But Mr.
have
Giraffe.
we have fixation toys, is what we call them, and different things. We have videos at the end of the room to get their attention towards the distance and all of those different things for our assessments. But yeah, it's kind of an art, if you will, to get an exam on a kid. Yeah.
Right, I bet parents are amazed to go, how did you get them to do that?
Yeah.
Can you teach me that? Okay, so here's a question for all of us. Is there anything that we can be doing day to day to be taking better care of our eyes? What's some advice you have?
Yeah, so in the kid situation, I think just don't brush things off. You know, a lot of times we look at kids and vision issues are things that go on. You're like, oh, we'll just let it go. I'm sure they'll be fine. The importance of taking your child in and getting them screened and getting them looked at, because again, like we said before, a lot of these vision issues will carry forward and can be lifelong if not treated appropriately.
And what about just our physical health, the things we eat, the things we drink, wearing sunglasses, staying out of the sun, avoiding bright light, screen time?
All good things.
All good things. Okay.
All good things.
I
all
check,
good
check,
things.
check.
Yes.
Okay.
I think the biggest issue we struggle with these days is screen time.
Yeah, I want to talk more about that because I battle it every night and every day. So are we seeing any link long term between pediatric patients that have extended screen time and their future eye issues?
Yeah, so there's no direct study saying, if you do this so much screen time, this bad thing will happen, right? Or these consequences with your eyes. But we do see a lot more eye fatigue, eye strain, blurry vision, just those symptomatic complaints of kids struggling more because they're spending so much time on the screens.
Is there a lot of things we just don't know yet?
Probably.
My son likes to wear glasses just because he thinks they're fun. So I got him some with the blue light.
Yep.
Does that help, the blue light protection?
Not a lot of data out there really proving that it has a lot of benefit. I would say I have a lot of patients that feel like it helps them. And so my recommendation is if you feel like it helps you, go for it. It won't hurt anything. I think some people feel like it's helpful, some don't. It's just more what feels comfortable for you.
Okay. Good. Okay, so our experts are here to answer your questions. Get those sent in. Use the chat on YouTube, Facebook. You can tweet us or email the Medical News Network. The info is right there on your screen. Let's get our COVID count. Dr. Dana Hawkinson on this Friday, Medical Director of Infection Prevention and Control.
Yeah.
Good morning. You started wearing glasses recently, kind of. Don't you have your readers?
I do have those for about the past 2 years, year and a half.
Can you see? Are you okay?
I'm okay.
You
It's
good.
better well, I have contacts because
Okay.
I've had to wear glasses since I was in 4th grade, so
Okay.
it's all good.
All right, as long as you can see the prompter.
Yes.
Okay, good.
I just make things up otherwise. so.
Absolutely. Okay, go for it.
But it is good to have these experts here for sure. It's very good to listen to what they're talking about. We are doing pretty good for COVID cases, 6 total, but only 2 active. No severe illness with none in the ICU and none on the ventilator. So that is a very good thing. Hopefully we can keep these numbers down for a long time and even into the fall.
Yeah, looking good.
Yeah.
All right. One thing that we did learn about COVID is that some people can get infected, but of course not have any symptoms. And
Yeah.
that was one reason we know it spreads so easily. Now there's a new study that gives us a clue as to why some
Yeah.
people never had those symptoms. Research published in the journal Nature ties it back to a genetic mutation. What can you tell us about that?
Yeah, I think this is very interesting for basic science and basic immunology. Just like you said, we know that 20 to 30% or more of people can be asymptomatic, meaning not having any symptoms of illness. we know that there is a lot of research into the basic science, basic virology, and basic immunology of COVID-19 and SARS-CoV-2. This is one example of that. What we are looking at is genetic analysis, and it's looking at human leukocyte antigen, or HLA, different types of that. And those help in our immune system and the functioning and the way that pieces of that virus is presented to our immune cells. What they found is that in up to 20% of people in this study had this variant of the HLA, which may allow their immune system to kind of react in a greater way than, say, the people who had symptoms. It's just one more piece of information that we're gathering about this. I think it's very good in trying to understand why some people are asymptomatic. This also goes to, maybe their immune system in one sense is stronger or operates differently than the other people who they did not see having no symptoms when they have an infection. But it is just one little piece. Again, it is not everything. We know that people in general, humans, we all have differences and we have variability in our genes, but this is one of those basic science pieces of knowledge that we can gain moving forward. Then how do we use that to help with this infection, but also other infections in our immune system in general?
All right, Hawk, thanks for the insight. Appreciate it. Any reporters with us today? Let's get to our community questions. Jeremy wants to know, what's the most common preventable issue that you see patients coming in with?
Preventable in terms of catching it early is going to be amblyopia.
Okay.
Yep. Preventable in terms of something you can prevent. One of the biggest things about children is a lot of the things that they do or they get are things that are going to happen no matter what they do, right? Versus adults, a lot of it's the decisions that we make in life that lead to our health conditions, right? Most of the time, the things that we see in kids they're born with them, right? This is in their genes, their genetic makeup, this is what's going to happen. And so for them, it's more recognizing it early and getting treatment early.
Are there, question from me is just, are there questions that parents should, if they have a concern, what's just an on-the-spot dinner table conversation or question they can ask a kid that might prompt them to share that there might be an issue? Are there questions like, can you see this? Can you see that? Can you read this? Is there anything to kind of just an on-the-spot test?
Yeah, just opening the discussion. And those older kids at the dinner table, just asking them, a lot of them when they come in to see us, parents like, I had no idea they were having trouble at school seeing the board, but apparently it's been going on for 2 years. I had no idea they see double from time to time. They never told me.
Right, just asking those questions.
Asking those questions,
Do you get are headaches
Headaches are a big one as well. Yep, headaches are a big one as well. Just opening that discussion, because a lot of times these are things that develop slowly for kids over time, and so they don't think to mention it or ask you about.
Yen has a question, and this may just speak to overall good health that we all need to be doing, but does exercise, could that help, and even adults too, keep away different eye diseases? Just how important is that type of movement overall for our health?
I think in general, exercise is good for good health overall, right? It helps your whole body in keeping you nice and healthy. There are some, same as the adult world, preventable diseases of high blood pressure, diabetes, a lot of medical conditions that result from poor health. And so I think exercise in general is good for overall health, and again, your eyes are part of that overall health.
So what's the benefit of seeing a pediatric eye clinic versus just an all-age eye clinic? Tori, just explain to us maybe some of those benefits so that people know when they pick up the phone to call why they're calling.
So especially like we talked about earlier, in those kids that are nonverbal or too young to tell you or give you answers, it's getting those vision assessments and checking the vision in a different way with our skill sets that we've learned to get the most accurate exam and pick up on things that maybe general eye practice wouldn't in those younger kids that can't talk or speak or read their letters or do a visual optotype kind of assessment.
Yeah, you said skill set. You said there's an art to really pulling out from children what's going on with them, and you see things that parents and the everyday person might not, clearly. So I like this question. Pauline wants to know, can an eye exam detect problems that are not vision related, like a neurological disorder? What do we know?
Absolutely. So your eyes are kind of a window into the brain. And so we can tell, even again on those babies, those kids who are not old enough to talk or even tell you their problems, we can, based on their motility, their vision, their pupil exam, their optic nerves, we can pick up on a lot of subtle signs and symptoms that relate to primarily brain, but also other systemic issues in the body. we have a wonderful working relationships with our pediatric department here at KU, and it's not uncommon for us to pick up on a kid that has signs or symptoms that have us concerned for an underlying neurologic disorder, and we call them. They facilitate having that child come to the hospital, getting workup, imaging, and really have a great cohesive relationship with the peds department here to make that happen.
Talk about the referral process. Fred wants to know, is the pediatric eye clinic only for those with a diagnosis maybe or a concern from a pediatrician who would send them on to you, or can just you do routine eye care there?
Yeah, that's one of the benefits of our clinic. Because all three of us have a different skill set, we can cover the basis from everything. Dr. Weiser, like I said, from an optometry standpoint, does a lot of the routine exams, contact lenses, glasses, just annual checkups, and some basic medical care. I do more of the more extensive medical care and surgical care. And then Tori works a lot with vision and alignment, again, especially in those children with developmental delays or other conditions that make those exams a little bit more challenging.
For the latecomers to the program, I know you mentioned this earlier, but go over this again. Cassandra wants to know, my kid frequently rubs their eyes. Is that bad or a sign? And what are some of those other signs?
Yes, so we get a lot of eye rubbing in our clinic, and in those little kids, it can be hard to tell. Is that something pathologic versus are they just tired and rubbing their eyes all the time? It can represent vision things. It can represent things like allergies, especially this time of year. My recommendation is to see if it's something that persists over time. Bring them in and have them checked out, just to rule out any underlying vision issues or anything more concerning.
And Tori, for where you sit, what would a typical appointment look like? Lily wants to know when they come in. How does that lay out?
So they start with either our wonderful technician, Manisha, or I, usually to start the exam, get a good history. We check everything that we can, depending on the age. Obviously, you can do more tests in older kids. But we do everything and do as much of a vision assessment that we can. We always dilate the eyes, because that's very important for Dr. Brockstrom to be able to do her assessment after to, one, look at the back of the eye and make sure everything's healthy, as well as check for any need for glasses. So in kids, obviously, they can't always be put in that machine like adults that go better 1, 2, 3. Yeah. So she's able to check what their prescription is with just some lights and a retinascope so that she can see and then prescribe glasses if they are needed.
Okay, last question. What foods are best for the eyes? What's the secret?
Yes.
It can't be just carrots. Come on.
I wish there was a magic food.
Is that even a thing?
Was.
Is that a thing, or is that just a lie I tell my children?
It's beneficial,
Okay,
right?
okay.
Carrots are always good. Never say no to carrots.
Right.
Carrots are always a plus.
Veggies.
And just all veggies, right?
That's right. And kids, it's just a well-balanced diet.
Yeah.
It goes back to that. The healthier you are, the healthier the eyes are going to be, and the healthier your vision's going to be. So as best you can in kids. Sometimes it's tough, but veggies, fruits, and that well-balanced diet just to help their health overall.
Easier said than done with my
Easier said than
7-year-old,
done.
but I appreciate the advice. I'll keep trying. Okay, so let's get our takeaways. Tori, what do you want folks to take away from this talk today?
Yeah, so I guess I would just say that we have a really good team in the Peds Optho section, and we're really excited for our journey here at KU.
Bring your kids in if needed.
Yeah.
If needed. Dr. Brockstrom,
Yeah.
what's the takeaway?
Yeah, so I would say the importance of getting your eyes checked. And those little kids, making sure they're going to their pediatrician or at their school and getting those annual assessments to make sure we pick up on any subtle findings that parents wouldn't otherwise notice.
Thank you both for being with us today. Learned a lot. Appreciate it. All right, and thank you to all of our viewers for being with us today. Have a great weekend. We'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update. Lori Finnerty calls herself lucky. She never had trouble moving after suffering a major stroke, but speaking remains a challenge. I'm Jessica Lovell on the next Morning Medical Update. What happens when the words won't come? The challenges and rewards of speech therapy for stroke patients. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.